Hello, I'm Dr. Katherine Anagnostou and I'm a consultant in paediatric allergy at St Thomas's Hospital in London. Today I will be talking to you about immunotherapy and its potential for use in food allergies. So first of all, what is immunotherapy and why do we give it to our patients? When we talk about immunotherapy, we are referring to the administration of small doses of a specific allergen that are gradually increased over days, weeks or months. And the aim of this process is to modify the response of the immune system in such a way that the allergen would now be tolerated. So for instance, if we are dealing with a patient who is peanut allergic, we would start by administering very small doses of peanut allergen, the peanut protein, in various different forms. We would increase these doses over days, weeks and months, and at the end of the process we would like to do a food challenge to check how much of the peanut allergen is now being tolerated by the patient. There are various different routes for administration of immunotherapy. And immunotherapy is a process that has been used for a long time for the treatment of other allergic diseases, such as, for instance, allergic rhinitis or hay fever, and wasp and venom allergy. So one of the commonest used routes for this type of immunotherapy is the subcutaneous route, which involves the administration of injections. The sublingual route is also used for the treatment of hay fever, for example, where we are providing the patient with sublingual drops. These are drops of fluid that contain the pollen allergen that the patient is sensitized to, and by giving these drops under the tongue at regular intervals, we are successful in desensitizing the patient to the pollen. Another route that is being used for administration of immunotherapy is the oral route, where the allergen is given via the mouth. This is the preferred route for oral immunotherapy for food allergies, and it is the route that has been used successfully in many food immunotherapy studies. The last route that is currently in development is the epicutaneous route, and this involves administration of the allergen via a patch and its application on the skin. So food immunotherapy has been a recent area of intense research. It is very important to say here that the use of immunotherapy for food allergies is still under the research umbrella. And there have been many studies that have looked into desensitization of patients with food allergies to all the common food allergens that we encounter in childhood. So research studies have focused on milk immunotherapy, egg, wheat, nut immunotherapy, especially for peanuts, and also fish. The oral route is the preferred route for food immunotherapy, like I mentioned before, and although there are some sublingual studies available in the literature, most of the research studies have focused on oral immunotherapy. Most of the trials have been successful. They have shown that the majority of patients are successfully desensitized by this process. And this means that the amount of allergen that is tolerated at the end of the study, at the end of the research trial when immunotherapy has been administered, is much larger than the amount of allergen that was tolerated at baseline. So that was before the patient had been on the study. However, the long-term tolerance issue of immunotherapy has not been addressed yet. What that means is that we don't know what happens 5 years down the line or 10 years down the line after these studies. So some research studies have looked briefly into this. They have discontinued immunotherapy treatment for certain amounts of time, and they have rechecked the patient's tolerance. The response in those occasions has been variable. So there have been patients that were able to tolerate the same amount of allergen as before. There were patients that were tolerating much less after discontinuation of the regular immunotherapy treatment, and there were also patients who returned to their baseline and were now unable to tolerate large amounts of the allergen. There are various benefits and risks in this procedure. So clear benefits include protection from accidental reactions, the ability to consume varying quantities of the allergen, and also an improvement in quality of life, which has been shown in different studies. There are also risks associated with this process. the most obvious one being frequent allergic reactions, especially during the updosing phase. It is very important to be aware that not everyone manages to tolerate the allergen, so although the studies have been very successful and the success rate is very high, there are still people for whom this treatment is not going to work. Severe reactions, although uncommon, have also been recorded in studies, so there are risks, including anaphylaxis. The long-term tolerance, like I mentioned before, has not been fully addressed yet. There are a few important messages that I would like to put across today. The first and most important one is do not try to do any of this at home. This is a very high-risk procedure. It can put you at risk of severe allergic reactions, including life-threatening anaphylaxis. Food immunotherapy is still under research, and although various places are hoping to be able to introduce this procedure in clinical practice in the future, there is still some work to be done before we're able to roll this out to all patients. The duration of immunotherapy is months or years, and current guidelines suggest that maintenance treatment is long-term. So at the moment, patients that have undergone immunotherapy studies are required to take either a daily or twice-weekly or weekly dose of maintenance allergen in order to be able to maintain their tolerance. The benefits and risks of immunotherapy need to be considered by each individual. Something that works for a family and a person might not work for someone else. So it's very important for the patients to be fully informed about the procedure and clearly understand the risk and benefits. The long-term effects of immunotherapy are still unknown, and all trials must be conducted under strict medical supervision in specialist pediatric allergy centers. Thank you very much.